Hey, what's up you guys? Hey, thanks for watching this video. In this video, we're gonna talk about why there should be death panels. Okay, so I was in the OR the other day talking to an anesthesiologist. Sometimes this happens, sometimes you're operating and they're talking to you and you're trying to concentrate, but they really want to talk to you, and so anyway, it's a little bit awkward. But actually this one was, we were finished and we were trying to get the patient over to the bed, and he's talking to me and I'm trying to maybe unwrap something, and I couldn't do it because he kept talking. Anyway, it was really interesting in what he had to say, and I never quite thought of it like this, but I think he's got a serious point. So his point was, I think it was when Mitt Romney was running for president or something like that, or I can't remember what it was, or Obama was doing Obamacare. The Democrats ran this ad that was who's that guy, Matt Ryan, wants to push grandma off the cliff. You know, they want death panels and blah 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 and all this shit. And he's like, you're goddamn right, we need death panels because we can't afford the care for everybody. Bear with me, I know you're going bananas right now. So the reason he was saying that is because 80% of Medicare dollars are spent within the last 6 months. Okay, do not quote me on that number. It is a rough round number. I don't remember the exact, to the percentile, whatever numbers they are, but that's that gives you an idea of what we're talking about here. So you go look up the actual number. I'm sure it's slightly different, but it's pretty damn close. Okay, the point is that we spend all of our dollars on patients who are going to die within the next 6 to 12 months. Okay, or a majority of our dollars. So the question is, should we just not spend that money on them? Not really, okay? That's not the point of that. The point of the death panel, okay, is to decide really which is futile care. And not only futile care, but which patients can we help, okay? Just because we're, giving them treatments is not necessarily helping them. And, I think a lot of surgeons might agree with this, especially trauma, because we see a lot of this. We want to give quality life, okay? We want to help people so they can have a quality of life after they see us. But many patients don't have a quality of life after we see them. But we're kind of in a catch-22 where, if you don't treat them, they're gonna die today, okay? If you do treat them, they're gonna die, but maybe just in a few months. So you might get that quality of life and you might not. Some patients are very easy to understand they're not gonna have a quality of life, and some patients aren't. Okay, so we're talking about, and you basically break those out and say, well, the ones that, could have a quality of life, you don't want to not treat those patients. But the ones where you're this is a 92-year-old lady fell out of her bed, right? Rolled out, fell out of her bed onto the floor, hits her head, comes in, EMS rushes to the scene, right? Ambulance, 5 paramedics, all this shit, expensive. Picks her up, takes her to the hospital, ER, trauma alert, all this shit like this. I mean, these are lots. This is a lot of money, right? We find out grandma has a head bleed, so we keep her in the ICU. She stays in the hospital for a week. She goes to rehab for a couple weeks, right? And then she can't move, because, she can't even stay in her bed. She not functional. So then in rehab, she doesn't move, she gets a DVT or she gets an infection and she dies. Okay, this is a very typical scenario. What's interesting about this is that I talk with these patients, okay? Not this patient specifically, but 90-plus-year-old patients, 100-plus-year-old patients. You know what they tell me? It's too long. Their life is too long. They don't have a quality anymore. They're sitting at home or in their nursing home, going from their bed to the bathroom to the kitchen, and that's it. Okay, sometimes people visit, sometimes they get grandkids, that's great. But I had a 102-year-old lady tell me, it's too long and there's nobody there to tell you what to do because you can't look up to anyone. You know, like I look up to guys that are 50, 60 that have been a surgeon for a long time and say, teach me, right? How can I learn from you? There's like nobody to learn from. There's nobody older and say what the path is to do. What do I do from here? She said, it's too long. Why? Just waiting to go. I think there's merit in the whole death panel. I don't think it's not a great name, honestly, but I do think we should pay more attention to who we're giving this exorbitant treatment to and who are not. I think the other thing I see a lot in around death is the families. The families have a huge say in all this stuff, even though we try to do just what the patient wants. You know, oftentimes there's siblings that are fighting and saying, no, you got to keep her alive, and the other ones are saying, no, you don't. We don't want to kill people, right? We're not there to like just write them off and say whatever. But sometimes maybe it is the doctor's duty to say, this is a bad scenario, she's not going to have quality of life after. And I try to do that. It's tough. You know, you can be a tough guy like in front of your friends and family and say, oh, I just tell everybody they're not going to live, forget it. But then when you're talking to the patient and, you know, especially a patient that's with it, you know, if they have a broken hip or, you know, if they get 5 rib fractures and they're 92 or 94, like, it's not going to last long, right? God is calling you home. I'm telling you. The families have this, and I see it on their face, like, you know, they don't want to let go. They don't want to let go for lots of different reasons, you know, typical reasons. Maybe you didn't get to say what you wanted to say to her, and she's on the ventilator now, and now she can't hear you, and then, you know, the last time you saw her, you've had a fight, or whatever it is. And so all those things play into it, but that is making healthcare unaffordable in our country. The other countries that have affordable healthcare do not do this shit. They don't go and save grandma at 95. They're like, peace out, grandma, you had a good life. And maybe we should start thinking about that. I think it sounds cold-hearted, but it's really not, because I don't want to be sitting there. If I get broken ribs, 7 broken ribs at 95 years old, I don't want to try and tough that shit out. Like, I already had my life. I'm not going to go and write a book now. You know what I'm saying? So, I hope you guys understand where I'm coming from on this one. This is probably going to get a lot of comments. Probably not nice ones. But, just think about that. All right? Just, if you're a young person with a family and you can't afford healthcare, that's why. There's other, that's not the only reason. There's a lot of reasons, and which the media does not talk about. They talk about lots of bullshit, lots of smoke and mirrors. It's in there. It's in our system. We can fix it, but we have to make hard decisions. And Americans don't want to make hard decisions anymore. Fuck that. No way. Right? Make the easy decisions. Give me the pill. Take my pain away. Oh shit, now I'm addicted to opioids. Too bad. Give me more pills, right? I don't want to make a hard decision. I don't want to stop. This is the stuff we're dealing with. We're dealing with too many people who don't have a backbone to make a decision. That is affecting all of our healthcare, all of our lives. I guess my suggestion is to you to look at your life and say, what hard decisions can I make? Where can I make my life better? It's all, you know the right thing to do. It's just hard to do it sometimes. You know, if you're a med student, the hard thing to do is fucking study for 12 hours a day, but that's the right thing to do. There's no way around that shit. You want to crush USMLE, you have to study your ass off until you want to puke and then study some more. It sucks, but that's the only way to do it. There's no freaking osmosis. You can't just like bang your head on the book and it goes in. Life is, it's good, but it's fucking hard sometimes. A lot of times just making the hard decision and sucking it up and doing it, that's the way to go. And then it's better after. Way better. All right. Oh man, this is a good one. I was so excited to talk about this one. Anyway, hey, thanks for watching this video. If you like it, click the little like button and subscribe to my channel would be great, and share this video with a friend or so. That'd be awesome, and I'll see you in the next one. Take care.